Imagine hearing doctors talk while your skull is open. Fearful face, you're awake, you can speak, and every second decides whether you keep your memories, your voice, or even your personality. Brain today, you're about to witness one of the most shocking medical procedures ever performed, brain surgery while awake, explained in stunning 3D. What if the most terrifying surgery in the world required you to stay awake the entire time? Fearful face, today, we're diving deep inside the human brain to uncover the unbelievable truth about awake brain surgery in realistic 3D. You'll discover why surgeons sometimes keep patients conscious, how the brain feels no pain, and what really happens when doctors touch the area controlling speech, memory, and movement. Every second inside the operating room can change a life forever. This is not science fiction. This is real modern medicine pushing the limits of human survival, precision, and courage. Prepare to see the brain like never before. Brain. Awake brain surgery is one of the most advanced and shocking procedures in modern medicine. Brain, unlike traditional operations where patients are fully unconscious, this surgery keeps the patient awake during critical moments of the procedure. Doctors use this technique when operating near sensitive areas of the brain that control speech, movement, memory, vision, or personality. The human brain itself does not feel pain because it has no pain receptors, which allows surgeons to safely work while the patient remains conscious. Before the surgery begins, anesthesia is carefully used to numb the scalp and skull so the patient stays comfortable. Once the skull is opened, surgeons wake the patient and begin communicating with them in real time. During the operation, the patient may be asked to speak, identify objects, count numbers, move their fingers, or answer simple questions. Every response helps doctors identify which exact brain regions are responsible for important functions. Special electrical stimulation tools are used to temporarily activate tiny areas of the brain. If touching one area suddenly affects speech or movement, surgeons immediately know they are near a critical region and must avoid damaging it. This incredible process is called brain mapping. It allows surgeons to remove dangerous tumors or abnormal tissue with extreme precision while protecting the patient's ability to speak, think, and move normally. Inside the operating room, every second becomes a careful balance between medical science, technology, and human survival. Brain mapping is one of the most important parts of awake brain surgery because it helps surgeons identify the exact functions of different areas inside the brain. Every person's brain is slightly different, which means doctors cannot rely only on scans or medical images during surgery. Even a tiny mistake near a sensitive brain region can affect speech, memory, movement, vision, or personality forever. That is why brain mapping is performed in real time while the patient is awake and responding. During the procedure, surgeons use a special electrical stimulation device to gently stimulate small areas of the brain surface. These signals temporarily interrupt normal brain activity for only a few seconds. While this happens, the patient is asked to perform simple tasks such as speaking words, counting numbers, reading sentences, identifying pictures, or moving different body parts. If stimulation suddenly causes the patient to stop talking, forget a word, or lose movement in a hand, doctors immediately recognize that area as critical and avoid damaging it. This technique creates a live functional map of the brain during surgery. It allows surgeons to separate dangerous tumors or abnormal tissue from healthy brain regions with extraordinary precision. Advanced monitoring systems also track the patient's brain signals, reactions, and responses throughout the operation. Neurosurgeons, anesthesiologists, and neurologists work together as one team, carefully analyzing every reaction from the patient. Brain mapping transforms the operating room into a real-time communication system between the brain, the patient, and the surgical team. Speech and memory testing during awake brain surgery is one of the most intense and fascinating parts of the entire procedure. While surgeons operate near critical brain regions, the patient stays awake and actively communicates with the medical team. This allows doctors to monitor important brain functions in real time and protect areas responsible for language, understanding, memory, and thinking. Every word spoken by the patient becomes a guide that helps surgeons safely navigate through the brain. During the operation, specialists may hold up images, letters, or objects and ask the patient to identify them. The patient may also be asked to read sentences aloud, repeat words, answer questions, or describe what they see. These tasks help surgeons locate the exact regions controlling speech production and language comprehension. If electrical stimulation temporarily causes the patient to pause, slur words, forget names, or become confused, doctors instantly recognize they are touching a sensitive area that must be protected. Memory testing is equally important when surgery occurs near regions linked to learning and recall. Patients may be asked to remember numbers, recognize faces, recall recent events, or respond to specific prompts during the procedure. Even small changes in memory response can provide valuable information about brain activity. Highly trained neuropsychologists closely observe the patient's reactions while surgeons continue operating with extreme precision. Every conversation inside the operating room becomes part of the surgical process itself, turning speech and memory into life-saving tools during one of medicine's most extraordinary procedures. Tumor removal during awake brain surgery is one of the most precise and delicate procedures in modern medicine. The goal is to remove as much of the tumor as possible while protecting the healthy parts of the brain that control speech, movement, memory, vision, and personality. Many brain tumors grow dangerously close to critical brain regions, making surgery extremely risky. Even removing a few millimeters too far can permanently affect how a person talks, thinks, or moves. That is why awake surgery combined with advanced 3D imaging has become a revolutionary technique for neurosurgeons around the world. Before the operation begins, powerful MRI and CT scans are used to create detailed 3D maps of the patient's brain. These images help surgeons visualize the tumor's exact size, shape, and location before making the first incision. Once the skull is carefully opened, surgeons use high-powered microscopes and navigation systems that act almost like a GPS inside the brain. The patient is then awakened during critical stages, so doctors can continuously monitor brain function while removing the tumor tissue. Special surgical tools are used to slowly separate abnormal tissue from healthy brain structures. Some tumors have clear boundaries, while others spread into surrounding brain tissue, making removal far more difficult. During the procedure, surgeons constantly communicate with the patient, asking them to speak, move, count, or identify objects. If the patient suddenly struggles with speech or movement, doctors know they are approaching a critical brain area and immediately adjust their surgical path. Modern operating rooms also use fluorescent dyes and advanced imaging technology that makes certain tumors glow under special lights. This allows surgeons to distinguish cancerous tissue from healthy brain matter with greater accuracy. Tiny suction devices, ultrasonic instruments, and precision cutting tools help remove the tumor piece by piece while minimizing damage to nearby structures. Every movement inside the brain must be slow, controlled, and exact because even the smallest error can have life-changing consequences. Throughout the operation, the surgical team carefully balances tumor removal with preservation of the patient's brain function and quality of life. The human brain is the most powerful and complex organ in the body, controlling everything from movement and emotions to memory, speech, and survival itself. Brain during awake brain surgery, doctors must understand these brain functions with incredible precision because different regions of the brain perform different tasks. Even the smallest disturbance in a critical area can change how a person speaks, thinks, feels, or interacts with the world. This is why understanding brain function becomes one of the most important parts of modern neurosurgery. The frontal lobe, located at the front of the brain, controls decision-making, personality, problem-solving, emotions, and voluntary movement. It also contains regions responsible for speech production. If surgeons operate too close to these areas without proper mapping, the patient may struggle to speak clearly or control body movements. The parietal lobe processes touch, pressure, temperature, and spatial awareness, helping humans understand the position of their body in space. Damage in this region can affect coordination and sensation. The temporal lobe plays a major role in hearing, language comprehension, and memory storage. During surgery near this area, patients may be asked to recognize sounds, repeat words, or remember information to ensure these functions remain intact. Deep inside the temporal lobe lies the hippocampus, a structure heavily involved in forming new memories. Nearby structures also help regulate emotions and emotional reactions. The occipital lobe, located at the back of the brain, processes visual information received from the eyes. If this region is disturbed, the patient may experience blurred vision, visual confusion, or loss of visual fields. Surgeons operating near visual pathways carefully monitor the patient's responses to protect eyesight. The cerebellum, positioned beneath the brain, controls balance, posture, and coordination. Even slight injury to this area can affect walking and fine motor control. One of the most fascinating aspects of the brain is its electrical communication system. Billions of neurons send rapid signals throughout the body using tiny electrical impulses. During awake surgery, surgeons use electrical stimulation to temporarily interrupt these signals and identify which regions control specific functions. If stimulation causes speech problems, memory loss, tingling sensations, or movement changes, surgeons immediately recognize the importance of that brain region. Modern 3D medical technology allows doctors to visualize these brain structures in extraordinary detail before and during surgery. High-resolution scans create interactive maps showing pathways responsible for language, movement, sensation, and vision. Some systems even track surgical instruments in real time while displaying the patient's brain activity on monitors inside the operating room. This combination of neuroscience, advanced imaging, and live-patient interaction allows surgeons to safely navigate one of the most sensitive organs in the human body with remarkable accuracy and control. Brain surgery is one of the most dangerous and high-risk procedures in medicine because the brain controls every essential function of the human body. Even with advanced technology, skilled surgeons, and detailed planning, serious complications can still occur during or after surgery. Every movement inside the brain carries risk because delicate nerve pathways and critical functional regions are packed tightly together. During awake brain surgery, doctors constantly balance the need to remove dangerous tissue while protecting the patient's ability to speak, move, think, remember, and survive normally. One of the biggest surgical risks is damage to functional brain areas responsible for speech and language. If critical language regions are accidentally injured, patients may experience slurred speech, difficulty understanding words, inability to form sentences, or complete loss of communication ability. This condition can sometimes be temporary, but in severe cases it may become permanent. That is why surgeons continuously test speech during awake procedures to detect even the smallest changes in brain function. Movement and coordination problems are also major concerns during brain surgery. The motor cortex controls voluntary body movement, and injury to this area can lead to weakness, loss of coordination, tremors, or paralysis affecting the face, arms, or legs. Some patients may temporarily lose strength after surgery due to swelling or irritation inside the brain. Physical rehabilitation and therapy are often required to help restore movement and motor control. Memory and personality changes can occur when surgery involves regions connected to emotions, behavior, and memory storage. Certain patients may struggle with short-term memory, concentration, emotional control, or decision-making after surgery. Family members sometimes notice personality changes caused by disruption of specific neural pathways. These risks become even more serious when tumors are located near deep structures of the brain that control emotional regulation and cognitive function. Bleeding inside the brain, known as intracranial hemorrhage, is another life-threatening complication. The brain contains an enormous network of blood vessels, and accidental vessel injury can cause dangerous bleeding that increases pressure inside the skull. Excessive pressure may damage surrounding brain tissue or become fatal if not controlled quickly. Surgeons use microscopic instruments, advanced imaging systems, and precision techniques to minimize this risk during the operation. Brain swelling, called cerebral edema, is another common danger after surgery. Swelling can place pressure on healthy brain tissue and interfere with normal brain activity. Doctors carefully monitor patients in intensive care units after surgery to detect swelling, seizures, or neurological changes. Medications are often used to reduce inflammation and stabilize brain pressure. Seizures can also occur during or after surgery because the brain's electrical activity may become temporarily disrupted. Some patients experience uncontrolled electrical bursts that affect movement, awareness, speech, or consciousness. Anti-seizure medications are frequently given before and after surgery to lower this risk. Infection is another serious concern because surgery requires opening the skull and exposing internal brain tissue. Even small infections can become dangerous inside the nervous system and may require additional treatment or emergency intervention. Emotional and psychological stress during awake brain surgery is also extremely intense. Patients remain conscious while hearing surgical conversations, medical instruments, and operating room sounds around them. Anxiety, fear, confusion, and panic can develop during critical moments of the procedure. Specialized anesthesia teams and psychologists help keep patients calm and mentally stable throughout the operation, while surgeons continue working with extreme focus and precision.